I started in pediatric home health a year and a half into being underneath a corporate entity, realized that I wasn't really able to use my full scope of practice as outlined in our practice framework and in the Colorado practice standards. And every time I would ask questions about that, I usually got met with a response of, "We don't do that." But I don't understand why we couldn't, because it's in our license and in our scope of practice. So I decided I would just go independent so I could do everything that the patient was asking for or that they needed in their care. I started my practice February 20th of 2020. So in case you have timelines in your mind, I had started my practice and everything was great. And then like 2 weeks later, the whole world shut down and I was required to change my practice from everything that I had known it to be to all virtual all the time and just really like organizing it completely differently.
Welcome to the Care We Need podcast, where we bring together patients and providers to explore how we can improve U.S. health, wellness, and human services systems to better serve the growing population living with complex illnesses. This podcast is brought to you by Bennis Companies, where we provide education, consulting, technology, and other resources to help health and wellness professionals streamline their systems and deliver better health outcomes for their clients. With us today is Holly Ross, an occupational therapist, water safety instructor, and the owner and founder of Community Aquatics and Occupational Engagement in Denver, Colorado. She offers valuable insights into occupational therapy, collaboration across the health and wellness space, and practical entrepreneurial guidance for those looking to start their own practice. Are you ready? Let's go. All right, so let's get started. Why don't you tell the viewers a little bit about yourself and what you do in occupational therapy?
So, hi, I am an occupational therapist, like you just said. So I am going on an OT for 7 years come this August, and I will have been my own private practice for 6 years in February. So I do kind of like a little bit of everything. I'm specialized, but I also really like to zoom in and out from a generalist perspective and then back down to like my specialist feature. Right now for our private practice, I have a lot of people coming to us for our aquatic therapy and learn to swim services. However, we are an outpatient practice in general. That's like our overall setting is outpatient, and we see pediatrics, teens, and they're still considered pediatrics, but teens and young adults. We just don't see geriatrics. So like 65 and up, not our area of expertise. I try to refer to someone else that has those diagnoses in their head. And then generally, we also have a lot of like medically complex individuals, chronic illnesses, and sometimes high behaviors as well. And we do have some that might have lower behaviors or not as many medical needs, but those are kind of like sprinkled in. A lot of people come to us because they have a lot of issues and a lot of health diagnoses, and they might not have had success at like other clinics or other spaces.
Oops, sorry, I had myself on mute. So is it primarily aquatic therapy that you do, or do you do a bunch of other things as well?
Primarily, we're outpatient. However, we have, I would say, the majority of our services in aquatic therapy and learn to swim combined at the same time right now, because that is just exploding. When I opened that sector in 2021, I had opened it because people were requesting it, like they had a need for it, and I still had my teaching license for water safety. So I was like, you know what? I'll try to refer out. I couldn't find anybody, so I just thought I'll just do it myself. So I did, and then we became a mobile Red Cross facility at the same time, and then now everybody like seeks us out for that. But we do also provide traditional outpatient, and the other two specialties that I've spent a lot of time with, and I've also trained underneath an optometrist and stuff, is vision therapy and feeding. So I do some of that too, but my clinic doesn't necessarily all the time. Generally, my practitioners that work for me are outpatient and usually aquatics because we just get so many requests.
So can you help break that down? Like what does an outpatient occupational therapist do? What does the clinic do? What do you focus on? What are you helping people with?
So I can't speak for every outpatient clinic. We're a little different. So outpatient is usually the place you go after you've been maybe in a hospital or unskilled nursing facility or something that was like more acute, where you had more medical severities going on. You needed an actual doctor team right there for life-saving care. And then you get discharged, or then you move on, and it's like like they wipe their hands and you're out. And unfortunately, that's where like some people get lost, but hopefully they come and find us because you need care after, and usually like how those conditions are going to impact your life and what that picture looks like, and if that picture needs to be adjusted, or if it is like, okay, maybe we can get you back to that, but it might look a little different, or kind of what their life looks like. And we specialize in those occupations, the things that occupy your time. So that can be a lot of different things throughout the day. But outpatient usually looks like they come to the clinic for a therapy appointment or they come to the pool rather than us going to them. However, I still do go to their houses sometimes if they need me or if they need a specialized home modification assessment. So I'm a little flexible. It's not a perfect answer.
So it sounds like you essentially help people adjust to life after surgery or life after hospitalization, and you help them reframe mentally, but also physically how they do life all over again. And if it's something that was in the case of a surgery or something that was very disruptive to their life, then it sounds like you help them adjust both their expectations and their living environment to be more supportive to their current situation.
Right, correct. We also will get people that have genetic conditions or congenital conditions, like right from birth, that will impact the way their life looks for the rest of their life. So they wouldn't have like a neurotypical kind of upbringing. They would be like neurodivergent or have something that they're going to need help with, like adapting to the typical world for a while, just because their brain looks a little different than ours, which is totally fine and usually really fun to work with, in my opinion.
And you said you also do, was it feeding? And there was another one,
Vision.
vision. So walk me through that. What does that look like?
So for feeding therapy, it's a common misconception that we all just know how to eat. And that's not the case when you've had like a brain injury or you have aspiration or swallowing issues. And commonly, people also think that a speech therapist is the only one that works on feeding. And that's also a misconception. It's a specialty area in both fields, in OT and speech. And it looks like hours and hours of education and traveling to different states, being hands on in other people's mouths, teaching them how to swallow, how to handle food, adapting like cups and plates and all different kinds of things to make sure that they can eat without having aspiration, which just means that that water gets into your lungs and then they can get sick, like they can get pneumonia from that or even worse. So we collaborate with other professionals during that time. Like I usually always work with a speech path that helps me read the swallow study or a radiologist, and then we can take that picture and move it to what it looks like going home. Vision therapy is kind of similar. The research actually shows that a lot of people that have diagnoses like autism, ADHD, Down syndrome, brain injury, that there is, I think I have to look at the research, so don't like completely quote me on this, but it's anywhere between like 30 and 50% dependent on the diagnosis that there is some sort of visual motor deficit or visual perception deficit in the client's brain or with their eye strength in general that optometrists miss. There's a small portion of optometrists that are actually specialized for functional rehabilitation, and the rest of them just measure acuity, like do you need glasses or not? And that's what you go to optometry for, and a small percentage actually does functional rehab. And those people train therapists like us to screen, make plans, and adjust and help people get stronger with their eyes or help them perceive better, things like that. Hopefully that makes sense. There's some jargon in there.
So it sounds like you also kind of work as a little bit of a coordinator for different types of therapies and perhaps different types of therapists for people who are either an outpatient or in your other areas. Would that be accurate?
Yes, for me it is. I get people that ask me, especially nurses lately, asking me if I am a social worker. Um, because I do like I'm pretty obnoxious with my communication in a good way. Like I'm very consistent and I'll be emailing other people whether they email me back or not, or whether they call me back or not, just with updates, how we're doing, seeking more answers. I try to look for answers in either research or I try to find like anecdotal stories that might help where I could connect a parent to a parent so that they could have that community support. I look for resources. A lot of our practice is mainly funded with Medicaid and Medicaid waivers. So we're mainly working with low income, high impacted individuals. And because of that, I have to look for a ton of different ways to get like even the smallest piece of equipment that they might need for like sensory based needs or other things. And so I've spent basically my whole time in Denver just growing those connections with other people and like weaving myself into like this network. So if I'm not the person for the answer, I try to make sure I find at least a direction that I can point them in that might have the answer or might at least give them a next step instead of just being like, I can't help you and see you later, whether they're my patient or not. Like if someone emails me and they have a question, I will answer it to the best of my abilities. Or if they want to submit a thing for my blog, I'll write up a blog article from a reputable healthcare provider, me, that gives them advice in my scope of practice. So those are like free resources I try to provide too, just because healthcare should be different. And I think that it should help people. And I always also think that the money comes. People are like, we got to eat. I do eat. And I do have a house and we live nicely, in my opinion. The money will come, but if you focus on that, or you focus on just like turnkeying patients out the door, I don't think, I don't know, I don't think you get as successful. You really should focus on like the community and building the connections and providing good service, and then everything will come.
People first approach, and then everything else seems to take care of itself.
Yes, exactly. Thank you for summarizing.
We'll get back to that conversation in just a minute. Right now, I want to let you know about two powerful keynote speeches that Tenay Benes is offering. One to help care organizations improve their systems, and one to help empower the people navigating complex illnesses within them. Her first talk, Win the War on Complex Illness, comes straight from the battlefield. As an intelligence officer in the United States Army, Tenay took the worst performing brigade in her area of operations and helped turn it to the best, using a framework she calls the 4 steps to winning a war. Now she brings that framework to health, wellness, and human services organizations so they can improve complex illness outcomes without rebuilding from scratch. Her second talk, Heal or Die, is deeply personal. Tenay spent years battling complex PTSD, chronic fatigue, depression, anxiety, and suicidal ideation. Today, she's thriving as a wife, mother, author, and entrepreneur. In this keynote, she shares the mindset and lessons that helped her take back her power, reclaim her life, and achieve real results despite disintegrated health, wellness, and human services systems in the United States. This talk is perfect for veteran groups, patient and caregiver associations, elder care groups, and civic organizations. Visit tenaybenes.com/speaker to learn more or to book Tenay for your next event. All right, back to it. So I know from our previous conversation and from what you were just sharing with me, you do a lot of work to collaborate, to build networks so that you can collaborate. And it sounds like you do most of that kind of on your own, where you mentioned earlier whether or not they respond to your emails, whether or not they work with you. You do a lot of work to reach out to other providers, to reach out to other resources. And it sounds like there aren't very many systems in place to enable that. It sounds like it's mostly on you. Is that accurate? Or is that, do you have systems that you can go to and it's all kind of, you have access to all these different types of people?
Well, I don't know about every system, so I don't want to negatively say that there aren't a lot of systems out there, but I would say that I do spend a lot of time, unpaid time, just emailing and trying to communicate with others. And there are, like, I think some networks growing for communities and practitioners, whether they're surrounded or focused on growing their businesses rather than the client care. I've seen that too. But yeah, I would say that I am doing a lot of the reaching out. It would be great as just get more networks. I mean, I have my groups of people that I talk to that I've built myself and we all get along. But I like as far as groups, it's very hit or miss if there's like an accurate group that I can point a client to or to connect them with the right person. I usually have to do a little bit of digging.
And what type of people do you usually tend to work with? You mentioned earlier, I think it was a speech pathologist. You said speech path. And then you mentioned one other, but what other types of people do you tend to work with as you pursue this for your clients?
So, in general, we collaborate with like our sister disciplines. I like to call them like physical therapy and speech therapy. I think I talk to those other disciplines the most out of all disciplines. And then The other one I had mentioned was nursing. I talk to nursing care coordinators all the time. I actually get them more often than I get the actual MD. Sometimes I get the MD, which is nice. I love when they call me. Doctors don't call me all the time, but it's great when they do and they have questions about a patient or if they actually read my plan of care that I faxed them and they ask a question about a goal. It happens sometimes, but it's not super common. I do get a lot of nurses that'll ask questions or want to follow up. The one that had called me, a social worker, was a nurse because I was requesting to get like a palliative team member for a patient, not because they were passing away, but because they need a doctor that specializes in some holistic ideas instead of maybe an orthopedic doctor. While they mean well, surgeons cut. That's what they do. So sometimes it's good to have both doctors on the team. Like, do we need this procedure? Do we not? How does it impact their quality of life? Things like that. Um, so yes, nurses, PTs, speech therapists. I also work with other professionals that are small business owners that aren't therapists, but like have a background in special education teaching. And let's see, other like small businesses that support the disability community that might not be therapists, and also other OTs. I have quite a few other OT friends in small business.
That's interesting. You mentioned small businesses. What type of small businesses would an OT work with to help their outpatient client?
So I have businesses that I work with that do school advocacy. So they're like paralegals or not necessarily, or they've spent a lot of time in special education, or they say they were ex teachers. I also have owners of like sensory based gyms that I'm friends with, and they come from multiple different disciplines. They service the disability community. Other people are like social workers or other like care coordinators with some of the, like, community centered boards around the state of Colorado. They run, like, day programs for individuals with developmental disabilities, and they might not be a practitioner themselves at all. They just have this role where they manage these programs, and I connect with, like, them as well. Or they manage small programs, nonprofits that do, like, adaptive yoga. I recently worked with one of them. That was really fun. And there's other small business owners that do different things, technological advancers too. Like there's one company that does like a vibration-based dance floor for events that's quiet and accommodating. So there's a lots of like little niche business owners that come from all different kinds of backgrounds and they often have like these really good ideas. And then they just like the execution. Sometimes they like want an opinion of a practitioner on how they execute something.
I recently interviewed someone who owns a company that does essentially genetic testing and is able to essentially figure out what type of diet or what kind of medications would be harmful or helpful for different types of people. And I could imagine that might be something that would be really helpful for someone in an outpatient situation. The company's called Eugenome, with Zachary Brooks, and they're a local. I think they're no, they're in Arizona, but I imagine someone like that might be someone that an OT could work with to some benefit. If there are other ones that I was wondering, PCMs, primary care managers, I kind of envision in my non-professional health and wellness self that PCMs seem to kind of do a similar job as OTs, but they're like inside the building versus outside the building. Is that an accurate assumption or?
I feel like the abbreviation, like PCM, it depends on I guess a lot of disciplines could fall in there, like OT could or social work could. I hear PCP a lot, like primary care provider, and that's usually the doctor they see once a year. That's like their main primary doctor.
Okay.
So I don't hear like PCM very often. I do hear a lot of like
It might be
care
a
coordinator.
military term that I got from my background, but I was imagining someone who does more of like coordination work between different providers. And that might be a false assumption that that's ubiquitous across the field. I could imagine and someone in that position might be someone that you might work hand in hand with, considering that
Yeah.
they do a lot of kind of similar, like trying to coordinate care from these different providers.
If there was another care coordinator that does as much as I try to do for my patients and clients, I would love that. I would love to work with other people for sure. It makes it easier on all of us if I'm not the only one that's sending out emails or texts or phone calls about updates or questions, but everyone has different caseload sizes too. So I think that plays an impact as well.
Definitely. But let's dream about that a little bit. So what would, if you were in charge of the future in how care coordination and collaboration happened, how would the culture look? What type of tools might be needed to essentially do everything that you spend most of your time doing? How would you describe that? What would it look like? And what would make essentially that job easier?
That's a big question, Brett. um, so I guess if one had to dream, I guess it would be really great if, I don't know, like every practitioner just gave a tiny bit more, like especially my cross-disciplinary friends, like speech and PT that I work with most often. Some of them are really great. I'm not saying like as a whole, I don't want to like put a profession down or anything. I think that, like, it'd be great if they emailed me every once in a while, or they sent me a text like, "So and so did this today," or "So and so improved on this. I'm working on this now." Really, what we get now, which Medicaid requires it now, which is kinda helpful because it makes other people do stuff now, which is great, but it's still like the bare minimum. And that's sending us their plans of care so that we can get our billing pars through. They must collaborate with us, OTs and PTs, and sometimes speech. Like, everyone must send each other their plans of care so we can see what they're working on, or our billing won't go through. So that's at least a really good start, but that's like a mandate. But it would be great if people did it on their own volition. I guess a system, I don't know. I'd
So
be
maybe if
grateful
there
for
was a
anything.
system in place that made that really easy to do,
Yeah.
made that collaboration and communication really kind of streamlined. You're able to share documents. And you mentioned there's the policy changes to, I hesitate to say enforce, but at least encourage collaboration. And then there's the cultural side of it where people, I think, become more aware of the jobs that the others do, and understanding who they could bring in. But then there's also the systems and the building systems that can bring those people together.
Yeah, I mean, if there was a way, that would be hard. It is in hospitals where like they can share documents across like different providers and stuff, but when you're like a small business or a small outpatient clinic like we are, I our systems are unique. Like we pay for our own HIPAA locked systems. Nobody can get into them. It's much harder to send documents. Other companies have their own rules. Like, even if I have signed a release of information and my patient has put that they like agree to consent between exchange of information, that setting sometimes requires their own form on a top of my form that the parent or the guardian must sign in order to like get that communication flowing. So that's really interesting. I think there's also sometimes I've seen in some of my parents like fear of practitioners collaborating together because they've been maybe wronged by a practitioner, or they have sensitive information and they're afraid that they're just going to talk behind the patient's back and talk about a bunch of stuff that they said to them during their visit. And that's not what happens for me. That's not what happens for me. I don't just like gossip and tell every practitioner. I usually call them specifically about something I'm looking to have answered or something I want to work with, not maybe what the mother had vented to me for 45 minutes and I'm just listening. Like, I don't even chart that. I just I let that person flow or vent if they need to. And if it's important, I will summarize it. But if it is something where they just wanted to share, and I know way too much personal information about so many of my people that no one will ever know. That's part of being like a HIPAA locked provider.
So let's go back into your story a little bit more. What got you into this very particular line of work? Very kind of unique. I think it's emerging more and more, kind of this cross disciplinary care, but it's certainly not something that I knew a whole lot about before, even just a couple of years ago. What got you into this type of work?
I first became an OT. I didn't even know what OT was. I was working 3 jobs through college and they were all part-time, and I was just trying to like pay for my books and my gas to get to school basically. I was working for an individual who had had a stroke, and I was doing like his respite care. And for those who don't know what it's basically just like you get to hang out with the individual, you cook them dinner, you might help them shower, and you kind of put them to bed and just take care of them. And so that way the parents can get a break, or they can have a date night or whatever may have you. So I was doing respite for this individual and I was just helping him accomplish stuff that he wanted to accomplish. And his mother said to me, "Well, you would make a really great OT." and Cindy gets the credit for that one, Miss Shinabarker said, "You'd make a really great OT." And I said, "I don't really know what that is." So I just looked around and I noticed that OT had like a nice meld of like creative, intuitive work, but also very like neurologic and had a lot of anatomy and physiology in it. And so I thought that was a really great like meld for me because I love the science stuff till the cows come home, basically. I could read neurology for fun. People think I'm weird. It's okay. Anyways,
We need people like you in that type of work.
I also love like art-based stuff. So I did like metal art in high school. I tinker here and there. I can repair like stuff on my truck. I don't really take it in very often. So I'm also kind of technical and pragmatic. And so OT was kind of like a really nice field because I probably wasn't going to make any money in art. And I don't really want to go to school for 12 years to be a neurologist. So let's mix them together. And it ended up being the right fit. And I jumped into grad school as a junior and then came out with 2 degrees. So that's kind of how that journey looked. And I went to Eastern Michigan University.
And then it's not just the care itself, you actually run your own company and you're building it from, it sounded like from the ground up. And from what I remember from our previous conversation, it seems to be doing really well. If I remember right, you have more people than you know what to do with as far as people applying.
Yeah. So, yes, built from the ground up. I started in pediatric home health and I still love it. I still have some clients that I see in their house, kind of like a year and a half in to being underneath a corporate entity. It realized that I wasn't really able to use my full scope of practice as outlined in our practice framework and in the Colorado practice standards. And every time I would ask questions about that, I usually got met with a response of, well, we're home health care, so we don't do that. Or you're home health care, so we can't bill for that. But I don't understand why we couldn't because it's in our license and in our scope of practice. So I don't play well with others when they put limitations on what the quality needs to look like for my patient. I do play well with others when they want to collaborate, but I mean, as far as like restricting what I'm able to do, even though the state says this. So, um, I decided I would just go independent so I could do everything that the patient was asking for or that they needed in their care and I didn't have to be restricted other than what Medicaid and the state license and my board passings, count for.
So what did that shift look like? I assume, or let's assume that there's maybe a practitioner working in a bigger corporate entity or maybe a bigger hospital, and they're thinking of striking out on their own. What did that journey look like for you?
Oh, fun, hectic, my facial expression. Anyways, so I kind of stocked up money for like 2 or 3 months because we had to pay, like, at the time we were living in the apartment, have to pay the apartment and other bills and things like that. So I stocked money away that would last us like 2 months. So that way I knew like I could focus on making sure everything transitioned well. And then I just jumped. And then a ton of my clients followed me on their own volition and like hunted me down to find where I had went. And I had went to private practice and they were like, no, we want to be with you. And so they followed me. And so I already had a very big clientele base. But basically I went from quitting my job and running my private practice like within a couple of months. I immediately and I dove headfirst into it. The fun fact is, which is the facial expression I always make, I started my practice February 20th of 2020. So, in case you have timelines in your mind, I had started my practice and everything was great. And then, like 2 weeks later, the whole world shut down. And I was required to change my practice from everything that I had known it to be to all virtual all the time and just really like organizing it completely differently. Big shout out to my fiance, now husband at the time. He would like say, "You need to go on a walk," after I spent 12 hours in front of the computer, and I would be very agitated about having to go on a walk, but it was always beneficial for my health. So I'd moved everything over, and by then I was just doing home health and like seeing clients privately and became a Medicaid provider shortly after that, worked on that application for a little while. That took me some time to get credentialed.
So what did virtual OT look like during the height of the pandemic?
A little while getting some some parents are older than others, and doesn't mean that all people that are older struggle with technology, but sometimes they do. So just getting them to get on the Zoom or getting them to understand the links was a really good first step. And then kind of what it looked like was trying to find systems that ensured HIPAA compliance at the time were interesting. Like now there's a ton of them, but like even 5 years
Mostly as a
ago,
result of the pandemic, not so much
yeah, yeah.
leading into it.
Yeah, exactly. So there wasn't a ton of telehealth before. Like, however, I still carry it with me today. Like, I think it was a nice shift because I see some of my families are in rural Colorado. Like, they're hours away from like a practitioner like me or a specialist. They have a regular doctor in their town, but nothing crazy. Or there's just one hospital for miles. I still see some people exclusively virtually. And I guess what it looks like is kind of whatever that person is striving to work on. It could look like working on showering, dressing, changing, getting ready for their day, their basic ADLs. It could look like a good example is I have some very severely epileptic children. And what that looks like is, especially if they're coming out of seizures and they've been at home, is just trying to get them back to anything, like anything. I mean, like playing with a toy or wanting to eat or wanting to cook in the kitchen, really anything. Post-ictally, some of the kids that have severe epilepsy, like LGS or Dravet's, they take a long time to recover, especially if they have cluster seizures. So that could be any kind of engagement in their life whatsoever. Playing with a sibling, anything is what I'm going for telehealth. During the height of the pandemic, I had to basically transition all my plans of care to telehealth. So it's a little rough for some of the physical things, like when I work with quadriplegic individuals. Not that the parents can't transfer, but the hour that I come to their house or they come to the clinic where I do all the heavy lifting is nice because they get a break physically. So I think it was pretty hard on parents and caregivers during the pandemic because everyone went virtual, school, practitioners. And so not only were they managing all those appointments, they didn't get any breaks. They didn't even get 45 minutes to like take a shower. I have some single parents that when I come into their house, they're like, "Can I take a 45-minute nap?" Because they haven't slept in a couple of days. I'm like, "Absolutely, like, I'll be here." And they're like, "I'm just right here and the door's open." Like, so sometimes we are like relief for caregivers. So I think it was pretty hard on caregivers during the pandemic, but I tried my best to make it easy and not to give any giant home programs or lots of exercises or anything so that they wouldn't feel that, I don't know, that they were overwhelmed because they were already overwhelmed to begin with.
That must have been a really stressful, but also really important, but also amazing, but also really hard time. There's, there's so much going on.
Basically.
You transitioning between two different the corporate side of things to running your own practice and doing that in the middle of a global pandemic where they didn't already have a lot of the things that they currently do to facilitate virtual work or people being able to work on their own. I'd like to zero in a little bit more on kind of the steps that you took to establish your own practice and the steps that you took to do it so well because I remember what you just mentioned, or I'm summarizing a little bit, like you had built a reputation with your clientele, which was probably really important. And then you had stocked up money to be able to focus. And then like, what did you do first? What would, if you were to put a list of like the first 3 to 5 things that someone should do, were they in that situation? Or if they're looking to branch off into doing that on their own,
Absolutely.
what would you say are the first few steps that someone should
I
do?
love talking about this because there's a ton of private practice owners that spend like hundreds of thousands of dollars in legal fees, not always required. You can if you want to. I'm not saying you don't have to, but I'm saying you don't have to. I basically just read on the Colorado, so Colorado is very accessible for business knowledge and the procedures that like Medicaid requires or that for OT practitioners. It's all free on HCPUF's like website. You can read through the giant manuals. It takes time, but I
HICPUF?
read through it all.
Is
Yes,
that HICPUF?
HCPF.
Okay.
And they have, like, all the manuals on there, all the rules. They have free webinars to teach you billing, stuff like that. But for business ownership, some of the first steps are gonna be figuring out your business name and then searching it and telling nobody about it so no one steals it. And if you like it, then you will apply for your EIN number, which is like your tax identification number for your business, and what kind of business you wanna be. Do you wanna be an LLC? There's also PLLC and there's also like corporation. So The one person I do recommend having on your team to start is a CPA that knows small business because they will give you recommendations based upon like how much you're expected to make, kind of what filing is appropriate for you. So for me in the beginning, like a lot of people, I started out LLC and I still am an LLC, but I'm taxed differently now. But I was an LLC because you can claim more deductions and expenses. And so it off balances your income a little bit. But then later on, it's not advantageous because your tax rate gets too high. And then your CPA will be like, nope, you got to get taxed as an S Corp now. And then your tax rate will lower so that you can do that. Basically, when you make that switch, it just means you have to put yourself on payroll and pay yourself a livable wage, is what my CPA calls it. So you need your EIN, you need a physical location for your business. Now, you could put your home on there if you want, but it is legal in the state of Colorado to use a UPS box. You cannot use a USPS PO box. But because UPS gives you a suite number, it gives you a legal physical address. So I use that and I have that. And so I had my legal physical address and then I also had to open my business banking accounts. So some of those tangible steps are EIN number, business name that you like, registering with the state, getting your address and
I
bank account.
assume the business name and the address also could feed over into a website with a domain and all of that.
Yes. I did website after. I did all the stuff legally that I had to do first, and I already had a decent clientele base, but I started there. And then I moved to website like later on because first I was just a Facebook page because it was free.
Okay. And then at that point, you had already kind of you had built your reputation. And at that point, you were able to start kind of, I don't want to say collecting, but people started coming to you at that point once you started posting on Facebook.
That time here and there. That one was, like, more word of mouth. That would have been, like, 2020, 2021, and people were coming to me, but I was pretty full for caseload, and I wasn't hiring or even thinking about hiring. I was like, "I'm just gonna do my own thing. I'm not gonna hire. It's fine. Everything will be good. It's fine." 2021, I was getting emails from clients or people inquiring from word of mouth or whatever, and they noticed the WSI in my email signature, which is water safety instructor for Red Cross. And I still kept my license and I still taught on the side just so I could keep my teaching license with them. People were asking me, well, do you see people with disabilities and do you teach people? And I was like, well, I did. Before I was an OT, that was my first job. Lifeguard and swim instructor is my first job at 15. I loved working with people with disabilities when I was a teenager and I had a wait list at the rec center and all those things. So I was thinking in 2021, no, I've been in the pool my whole life. I'm not going to do it. So I attempted to seek out another practitioner that was doing adaptive swim and occupational therapy like in the same practice at the same time with one person. And I couldn't really find it. I couldn't even find a lot of adaptive companies, to be honest, or I would find an adaptive swim teacher but had no therapist type background. So then inherently it became a problem when they needed help with regulation or a physical disability. And then so I thought, you know what? I wonder what it takes to do it by myself. So I reached out to like my Red Cross representatives. I'm like, how do I get this licensing agreement so I can use this curriculum and become my own facility and things like that? And then I worked out that agreement with them. And then I became licensed to use their curriculum as a mobile facility. And I opened the aquatic sector and started seeing people in the pool. And people would see me at the pool, started asking, and then the snowball, it just like kept going. And then now it is obnoxious. The snowball is like, I don't know, a whole snowman all the time.
But it looks like you had enough put in place already so that when the people started coming, things were set up to handle it.
I'm good at pivoting and adapting, if that's what you mean. I don't know if systems were in place. Legally, they were all lined up. But if you're
But that's
talking
no small
about,
thing, having the all the legalities lined up so
yeah,
that you can do that. And then I assume you started hiring people at some point.
yes. So I started hiring people about 2 years ago, roughly right around that time frame. So I spent maybe 2021 to 2023 by myself. I had cleared my wait list one time by myself. So I was working like crazy hours and all the time. then it came up again and I said, "Oh no, this is a problem." Like people sometimes see us for years and I don't have any more room at all. And so it took me that time frame being by myself 2021 to 2023 in my own practice to figure out how to do what I do and then how to spit it out to someone so that they could do it too and do it with the same quality that I do it. Maybe not the same. No one's the same as me, but similar enough that they could work for me or they embody the ethics and values that I'm going for and how I approach client care. And so once I figured that out, I started hiring and training. And now we have three other staff besides myself, two other OTRs and one COTA. For people who might be listening that don't know the breakdowns of the professions, a COTA works underneath an OTR. You might have heard of like a doctor, then a physician's assistant. Like they work underneath like someone else's scopes. PAs have a little more freedom than COTAs do, but COTAs follow my plans of care, but she's great.
We'll get back to that conversation in just a minute, but we have some exciting news to share. If you or someone you love has ever struggled to find the right provider for a complex illness, or if you're a provider that is tired of spending thousands of dollars getting new clients in the door just to find out they're not a good fit for your practice, then this one's for you. 194 million adults and 22 million children suffer from complex illness in the United States, causing over 80% of all American deaths. This isn't the fault of the patients or the providers, but the disintegrated system in which they live and work. Our research found that patients have to try up to 17 different providers and spend up to $50,000, with fewer than 20% of those actually getting cured. On the other side, most providers have to spend around $800 to get each new client in the door, and then have to waste precious hours screening, intaking, and diagnosing that client, just to find out the client is not a good fit for their practice. Now everyone has to start all over again, driving up costs and driving down success. Companies is getting ready to change this. We're launching The Care We Need, a new platform designed to streamline that process for clients and providers alike. The client will be able to enter their symptoms once in one place from the comfort of their own home. The platform will then assess their information and match them up with a number of relevant providers in their area and at their price point. The providers will then receive a warm handoff with pre-screened clients committed to their programs, intake data already collected and ready in hand. This may sound like a lot, but I promise you it's only the beginning of what this platform will offer. Go to benniscompanies.com to sign up for our newsletter, be the first to know about user testing opportunities, or donate to support this cause. As always, like, subscribe, and send this episode to someone who would benefit from it. All right, back to it. So have you ever considered like doing any kind of training and then maybe franchising or licensing in order to kind of handle that wait list?
So I train all my staff myself, one to one. I don't have an admin that does that. I can't really afford one. I try to pay my staff as best as I can. And in order to do that, I don't want to have somebody that's not a staff that's getting money off of the backs of everyone else. So right now, it's not something that I want to do. Um, Franchising, that's an interesting concept. I don't want loss of quality. So I am very controlling in the sense of making sure that people get the quality care they need. I've seen other outpatient clinics get big or franchise, and something is lost when they get too big. So I am working
Yeah, I
on
hear you.
controlled growth, and I'm okay with that. The people on our wait list know there's a wait list. I'll even say, I recommend you look at any other adaptive provider. You might be on this wait list for a year. And they'll be like, no, we're going to wait. I don't want to go to anybody else. And so that kind of commitment from wherever they found us, from word of mouth or online, or they've been to one of our free community events that we do for adaptive swimming, any of those things, that kind of commitment from someone who doesn't even know us, I don't want to lose that. That trust in a provider means that I've built something that I want to grow in a slow and controlled way so that everyone gets care that's really quality.
That makes sense. And it is something that's definitely needed. I think in America, we have a huge focus on grow, grow, grow. And there's a loss of you need to grow healthily. You need to grow at a pace that is manageable, that you keep the quality while you grow. But it also does make me think of maybe something like workshops. I'm wondering, have you ever considered hosting workshops either for clients or for people who want to learn what you do and how you do it?
So, some of the ways I'm spreading some of that knowledge is we do 3 free events a year where the whole family is welcome, siblings, cousins, nurses, care providers. and we do free swim events where everyone can network with each other. We'll jump in and out of the pool and teach them tips or tricks while we're there if they have questions without getting like a formal plan of care established or they're on our wait list. I also do caregiver workshops here and there, depending on what the topic is. Another friend of mine, Katie Owens, that you had interviewed, she and I do some caregiver workshops together on sleep and pain and KT taping because I love doing KT taping. So, and
What
then
is
I'm
that?
also originally called kinesio taping. There's like other off brands of tape now. It's a stretchy based kind of athletic tape that you can use for supporting of joints, bodily structures, but you can also use it to decrease inflammation. And so there's a couple different uses for that. So I love that. And Katie Owen specializes in sleep and pain. So we kind of pair those together and had some caregiver workshops. I'm also developing parent workshops for swimming. And it's just going to take some time because I'm trying to figure out how to make that all palatable, but mainly around like water safety or being able to access these water environments and teaching some of these parents. Some of them need to improve their own swimming skills. So just having a little bit more confidence in the water themselves, but also having confidence when they take their child who might be like nonverbal and have like a level 3 autism diagnosis to the pool and what that looks like because they're not going to call for help when they are in the water or if they're in danger. They might even engage in self injurious behaviors when they're overstimulated in the water or something like that. So, a really good example is I had a client who went to Water World, and this is what inspired me to like think about these caregiver workshops that I'm trying to develop in the pool. And his mom and him and the dad were all floating on tubes in the lazy river. And the younger one had flipped his tube. And at the time, he had just started with me. He wasn't really swimming on his own yet. He is now. But he had flipped his tube and he like had started drowning. And I don't know if you've been to Water World, but all the tubes are kind of like on top of each other and there's only lifeguards every so often. So it's not like they weren't doing their job. It was just that the timing and the place and the visual, it's easy to lose someone under the water. So dad caught it, but at the same time that the son flipped, the mom also flipped. So both of them were disorientated. Mom took increased time to stand up, wasn't quite sure. This is how she described it to me. She's just like, I wasn't even sure like where he had gone. And by the time I had stood up, he was down there. And luckily dad was there and he got him. Things like that happen so fast. So it would be great if there was a class that practiced some of those scary things with parents, not with their kid right there, but just them and other parents. And they just practice some of those scary things like flipping off a tube upside down and just not choking and practicing their own body control so then they can help co-regulate their little one when something like that happens or an emergency happens. And then the last thing that I'm hopefully copywriting and publishing by the end of this year, I'm going to bang the desk, is an aspiration protocol for swimmers. Aspirators are someone we take in the water and we'll teach them how to go underwater, but nobody else that I know of does it. So I think I've created it and I use it in my practice. And so when that is published, I'm excited about that coming out. And then other practitioners can use it and learn from it. And maybe other adaptive teachers can learn it. And then maybe there's always going to be kids and families that need us, but if they don't have to wait on the wait list for a year, that would also be great.
That would be amazing. And like you said, being able to practice some of those high stress situations in a safe environment is incredible. I know it's something that my background being in the military, it's kind of everything that they do is try to build a high stress environment and then like run you through it before you ever get into a war zone. And it's something that is incredibly valuable to be able to keep a clear head while the bullets are flying. And I
Yeah.
can imagine the same type of stress, especially because if you're in a situation where you're a parent of someone who has special needs or all this, and you're already dealing with a heightened sense of stress, a heightened sense of exhaustion, and being able to practice in a safe space, but one that has that type of those cortisol pumping and all of that would be immensely valuable. I would love if you could take, moving on to a different topic, I would love if you could take just a brief time to address a couple different populations, a couple different people who may be watching. And the first one is just people who might not, they know they need something and they don't know whether it's OT. What should they be looking for? And what would you say to that person to say, not only for some encouragement, but also here are some things that you might want to look into for someone who's looking around who might need OT?
Okay. It's very dependent on maybe diagnoses and type of people that might have questions, but I would say that someone who needs OT might have problems engaging in their daily occupations, is what we call them. And it's not just your job, it's things that occupy your time, like we've been talking about. So, eating, sleeping, chronic pain, trouble dressing, trouble engaging in those recreational based activities, which there are other disciplines that address those too, but you might need a specialized OT to start by identifying the problem. And then you could step down and work with other disciplines in a longer hour session, more than an hour. Rec therapist is what I'm thinking of specifically, but sometimes we help pinpoint that, and then I can refer down when they need 5 or 6 hours of adaptive kayaking or bicycling or something like that. Other things that I would consider being a good fit for OT is people that have kind of like lifelong things going on, injuries, diagnoses, something that's not going to leave you in 6 weeks, because it's really something like that, depending on what it is. Chronic pain, a shoulder from high school football that never healed right, or that you can't get surgery for, arthritis, things like that, where they're going to be impacting you on a daily basis across multiple occupations. Again, things that occupy your time. Then I would consider that person probably a good fit for OT, at least to get evaluation to see what's going on.
And I would imagine on the emotional side of things as well, I feel like just the importance of being able to dream past your current situation. Like, this may be something that you've lived with for years. And so your life has kind of adapted, but there might have been dreams that you had that are still possible with help, are still possible with some adjustment,
Yes.
lifestyles or things that you want to go do, whether it's go hiking or something, connect more with the people around you, that there's still hope for those type of dreams, even if it might take a little bit of adaptation and a little bit of help from someone like an
Yes.
OT to help you take the steps you need in order to get there. Your dreams are still possible, just maybe there's some scaffolding needed in order to get you to that next step.
Yes. And occupational therapists, at least I think one of our strengths is we're really good at breaking things into a million pieces and figuring out which piece is the problem, and can that piece be adapted or circumvented or something, so that we can get them back to the big thing that they're trying to engage in. And I also realized when you asked me about type of people that I left out, a big population that I work with. So like mental health diagnosis, PTSD, trauma. Also, I have quite a few systems I've worked with that have dissociative identity disorder, and getting them all to like agree with each other so that they can take care of their body and do the things they need to do during the day, also really important. So those could also be people for us as well.
I know for myself, we have uh, ADHD, we have autism, we have TBI and trauma all in the same household. And so we've employed an OT before, and she was very helpful just in kind of understanding what are some of those changes that we can make in order to settle our nervous system, to be able to work with each other. What are some of the supportive tools that we need? And so we personally have benefit a lot in this house from the services of an OT. I can advocate for that. There's a second population that I'd love for you to address are the people who are practitioners who are looking to start off on their own. They're looking to do something bigger, looking to do something different, and they're staring at that long Grand Canyon gulf in front of them that they're getting ready to, that feels like they're getting ready to jump. And what would you say to those people about the emotions of it and also just the practicality of it and the how they're
Well, for practicality, I would just say make sure you have some of those concrete steps lined up that we talked about. If you don't have some of those concrete steps lined up, it doesn't matter how jazzed you are about it, things could go south really fast. So just make sure you have like some of those concrete steps lined up that we had previously talked about. And then maybe like an actual tangible plan that you write down, even if it's 10 bullet points that you just like actual steps, not like, I want the sun to be bright, because that's not very specific. Or just be like, in a month, I'm going to have 2 private clients, or in this many weeks, something that's very tangible that you know you can achieve. And for the emotional part, I actually mentor a clinician in South Dakota right now. I love working with her. She's starting her practice that's just like mine. So she's my mentee, but she's great. I would say like you can do it. The problem for OTs usually is that we're not taught a lot of this in school. We're not taught entrepreneurship. We're not taught billing, sorry, not building. And because of that, a lot of people are scared. Like, what happens if I don't succeed? What happens if I can't pay my bills. And I would just say, when you make it everything you have to do, you have to succeed. Or for me, you have to succeed or I'm going to be homeless. So that is what I had done to myself. And that might be too stressful for some people. Some people have like a side part-time job on the means while they start their business and grow their clients, and then they slowly taper hours back there. Seen that as well. Front loading, saving money, seen that too. But I would just say that to those practitioners that are listening that you can do it. It's possible. There's practitioners doing some really fun stuff. Like I know I have a lot of aquatics going on in the mobile Red Cross facility, but I know another OT that's private practice for rock climbing. And so that's really cool. Like that's his specialty. And my friend, like I keep mentioning Katie, chronic pain and sleep. I'm trying to think of some other really fun OTs. They're like swirling around, not in my head currently. Like hippotherapists that work with horses or equine based therapy. So there's some really fun settings. I know. And then the Uncommon podcast I had done with Patricia, there's OTs that work in post incarceration populations, post military populations that have just a private practice focus on that. I know a couple practitioners in Michigan who are neurodivergent themselves that run a virtual private practice for adults that are neurodivergent, young adults. So they do like a coaching based style. So really, there's like the sky is the limit as long as you're within your scope of practice, but our scope of practice is huge. There's people in pelvic health, postnatal care. Like there's so many opportunities to specialize, and everyone thinks that we have to be in competition with one another, but that's just not the truth. The truth is there's so many people to help, and there's new people with disabilities either being born or created every day due to whatever circumstances is going on in that individual's life. And there's always wait lists. There's always like, we have too few practitioners and so many more clients and patients that like require assistance. So if we all work together a little bit better and collaborate, we could all try to like, create a more wholesome image of what like life could look like for a lot of these individuals.
That's amazing. And on the note of collaboration, let's talk to the third population, which is the practitioners who are looking to become more collaborative, looking to become more holistic in that they want to start partnering with people who work in other practices, other disciplines in order to improve their clients. What would you share, what some advice or just some perspective that you would share with people who are looking to be more collaborative in the health and wellness environment?
I would say you just start asking. That's a lot of the problem, I think, is people are just like scared to email or scared to ask about collaboration, which like the worst thing someone's going to say to you is no. So they're not going to say like no and shun you. Nothing like that is going to happen. They're just going to be like no, or they're not going to answer your email. And I wouldn't be discouraged by that because out of like, I don't know, the hundreds of like collaboratory events or business cards I've gotten from people or emails at conventions or whatever. Out of like so many of those, you'll find your people. You'll find the people that want to collaborate. You'll find your good people, but you might have to send 100 business cards out, or you might have to meet 100 people to get 10 or something like that. But I would say like, you just have to start talking and start working with people in any kind of capacity, texting, emailing, I don't know, going to conventions and talking to people, going to happy hour and just saying hi, anything, because you'll find your people. It just takes a little bit of time.
And the other part of that is that once you build a relationship with someone, then you're likely going to be collaborating with that person over the next years, decades, maybe. And so there's effort up front, but then there's a payoff over a very long term, and you're building your network of people that you can bring in to your circle and bring to bear upon your wait list or the clients that you're trying to work with. There are also very collaboration oriented conferences. I went to one in Philadelphia a few weeks ago, which was the Academy of Integrated Health and Medicine, and essentially is very, very holistic minded, very cross domain thinking people who are trying to essentially build out the health and wellness and medicine sphere to encompass a lot more. And just going to a conference like that, I encountered so many different people who work in so many different environments, so many different types of disciplines. And you get their business card and then you start slowly building your network. And there's also stuff like Eventbrite has different groups that meet up in order to start in order to start building your network in that way, be people who work in the health and wellness space or people who are running events that you can go find and look for. And maybe you go attend one of their events and then say, oh, this is someone I could work with, and then start up that
Yep.
conversation with them. There's so many opportunities, especially now that you mentioned this is very different than when you first started up, which was before all of these online tools were put in place, the HIPAA compliant and the collaboration and the online meeting, virtual meetings and all of that. Now there's so many different options. So
Yeah.
really it's an open horizon for anyone who wants to go that direction.
I agree. And there's also a lot of free options too. Like sometimes you can pop in on like random happy hours of so and so's, or another provider will invite you to something to just to say hi, or so you don't always have to go to like big events to meet people. You just have to keep trying and keep communicating until you find the people that you're looking for and or that you have the battery for. I'm very introverted, which is seems odd for what I do and what I've
I
built.
would not have guessed that.
Yeah, so I can only handle so many social events, like, in a month and or even in a couple of months with, like, all these practitioners, because 'cause I'm constantly communicating virtually with them all the time or emailing or texting or trying to get talking to them. For me to go to events, it's like every once in a while because I get really tired, like, chatting and socializing, and I have to, like, reboot myself at my house by myself or
It's
with
part of
my
the reason that
husband.
I like online interviews and all of that, because I can set myself up. I have my favorite cup of coffee. I have everything that I need. And then I just log on and I'm in my space while you're in yours. So
Yeah.
that definitely helps me a lot.
Yeah, I also just need to like overall wellness. I have to have the right amount of sleep and my brain has to be in the right spot. I have a pretty long-standing trauma history. So if I don't get enough sleep, I can't parse out certain things or if I'm having a lot of flashbacks, I can't like organize and that's not a day I'm going to do social events.
Well, Holly, thank you so much. This has been an amazing conversation covering what you do in aquatic therapy and OT in general. And especially, I think you brought a really unique perspective into the entrepreneurship in the health and wellness space. I feel like that was a really valuable thing for people who are perhaps looking to broaden what they do in this world. So thank you so much for the time that you spent and for the wisdom and the insight that you've shared. Thank you.
Thank you for having me. I really appreciate it.
Thanks for joining us today. Be sure to check out our next episode here and use the comments to ask any questions or suggest any future topics. If this episode was helpful to you and you want to support our mission to improve U.S. healthcare and win the war on complex illness, you can donate any amount using the following QR code or the link in the description. As always, like, subscribe, and share this episode with someone who would benefit from it. See you next time.